Have you ever experienced that tingling sensation in your hands and feet? That uncomfortable numbness that makes simple tasks difficult? Today on Health Morph, we're revealing natural remedies that may help restore proper circulation and relieve numbness in your extremities. Section 1. Understanding numbness. Before diving into remedies, let's understand what causes numbness. This sensation typically occurs when blood flow is restricted to certain areas or when nerves become compressed or irritated. Common causes include poor circulation, prolonged sitting or standing, vitamin deficiencies, especially B12, nerve compression, underlying conditions like diabetes or thyroid issues. While occasional numbness is normal, persistent symptoms should always be evaluated by a healthcare professional. Section 2. Disclaimer. Important health notice. The remedies we're about to share may help with mild occasional numbness. However, they are not replacements for proper medical care. If you experience persistent numbness, sudden onset of symptoms, numbness accompanied by weakness, or numbness that affects an entire limb or one side of your body, please seek immediate medical attention. These could be signs of a serious condition requiring professional treatment. Section 3. Warming oil massage. Our first remedy is a warming massage oil that may help improve circulation and reduce numbness. You'll need 2 tablespoons of a base oil like sesame or coconut oil, 5 drops of ginger essential oil, 3 drops of black pepper essential oil, 3 drops of cinnamon essential oil. Warm the base oil slightly, never hot, then add the essential oils and mix well. Using firm but gentle pressure, massage this blend into your hands and feet using circular motions. Focus on your palms, fingers, soles, and toes for about 5 to 10 minutes. The warming properties of these oils may help stimulate blood flow to your extremities, potentially reducing numbness and tingling. For best results, perform this massage before bed and wear cotton socks and gloves afterward to retain warmth. Always do a patch test first and avoid using these oils if you have sensitive skin or open wounds. Section 4. Contrast hydrotherapy. Contrast hydrotherapy is an age-old technique that may help improve circulation by alternating between warm and cool water. You'll need 2 basins, one filled with comfortably warm water about 100 degrees Fahrenheit or 38 degrees Celsius, and another with cool water, about 65 degrees Fahrenheit or 18 degrees Celsius. Never use extremely hot or cold temperatures. Begin by soaking your hands or feet in the warm water for 3 to 4 minutes. Then, switch to the cool water for 1 minute. Repeat this cycle 3 to 4 times, always ending with cool water. This temperature alternation may help expand and contract blood vessels, potentially improving circulation and reducing numbness. For enhanced benefits, add a handful of Epsom salt to the warm water and a few drops of peppermint essential oil to the cool water. Try this technique once daily, preferably in the morning to energize your extremities for the day ahead. Section 5. Nerve-supporting nutrition. What you eat plays a crucial role in nerve health and circulation. Consider incorporating these nutrients into your daily diet. B vitamins, especially B12 and B6, which are essential for nerve function. Sources include eggs, fish, poultry, dairy products, and leafy greens. Magnesium. This mineral helps regulate nerve function. Find it in dark chocolate, avocados, nuts, and whole grains. Alpha-lipoic acid, a powerful antioxidant that may support nerve health. Sources include spinach, broccoli, and organ meats. Omega-3 fatty acids. These may help reduce inflammation around nerves. Find them in fatty fish, flax seeds, and walnuts. Staying well hydrated is also crucial for proper circulation, so aim for at least 8 glasses of water daily. Section 6. Targeted yoga poses. Gentle movement can work wonders for improving circulation. These simple yoga poses may help reduce numbness. Hand and wrist exercises. Extend your arm with palm facing up. Gently pull fingers back with your other hand. Hold for 30 seconds. Repeat with fingers pointing down. Circle your wrists 10 times in each direction. Foot and ankle exercises. Seated foot rotations, 10 circles in each direction. Point and flex your feet 15 times. Spread your toes wide, hold for 5 seconds, release. Repeat 10 times. These exercises are especially beneficial if you spend long hours sitting or standing. Try to incorporate them into your routine several times throughout the day. Section 7. Acupressure points. Acupressure is an ancient practice that may help improve circulation and reduce numbness by stimulating specific points on your body. For hand numbness, press the fleshy area between your thumb and index finger, known as LI4. Apply firm pressure for 30 seconds. Release and repeat 3 times. For foot numbness, press the point between your big toe and second toe about 1 inch back from the webbing, known as LV3. Apply firm pressure for 30 seconds. Release and repeat 3 times. Another beneficial point is located at the center of your calf muscle, known as BL57. Massaging this point may help improve circulation to your feet. Apply pressure to these points for 2 to 3 minutes, several times daily. Note: avoid the LI4 point if you're pregnant. Section 8. Lifestyle Adjustments. Simple lifestyle changes can make a significant difference in preventing numbness. Avoid crossing your legs for long periods. Take regular movement breaks when sitting for extended times. Check your posture. Poor alignment can compress nerves. Wear properly fitting shoes that don't constrict circulation. Consider ergonomic improvements to your workspace. Limit alcohol consumption and quit smoking, as both can affect circulation. Manage stress through meditation or deep breathing exercises, as stress can worsen circulation problems. Remember, consistency is key. Implement these changes daily for the best results. Section 9. When to see a doctor. While these home remedies may help with mild, occasional numbness, certain symptoms require professional medical attention. Numbness that comes on suddenly. Numbness accompanied by weakness, confusion, or difficulty speaking. Numbness following a head, neck, or back injury. Numbness that affects an entire limb or one side of your body. Persistent numbness that doesn't improve with home remedies. Numbness with pain, redness, or swelling. These could indicate serious conditions like stroke, nerve damage, or vascular problems that require immediate care. Conclusion. Numbness in your hands and feet doesn't have to disrupt your life. By incorporating these natural remedies and making simple lifestyle adjustments, you may experience significant improvement in circulation and sensation. Remember, these remedies work best when used consistently and in combination. Give your body time to respond and adjust your approach as needed. If you found this information helpful, please subscribe to Health Morph for more natural health solutions. Hit the notification bell so you never miss our latest videos on optimizing your well-being naturally. Stay healthy, stay informed.